It's time for your nursing tip of the week, and in this week's tip, we're talking about going AMA. If you don't know what AMA means, it stands for Against Medical Advice. If you've worked in the hospital for any length of time, then you may have taken care of a patient who wanted to leave AMA, meaning they wanted to leave the hospital before they are ready to be discharged. Patients that leave AMA are choosing to do so before their provider discharges them from the hospital. Going AMA is not always the best option for a patient. It causes an increased risk of readmission to the hospital and also an increased risk of death. Before a patient can leave AMA, two things need to happen. One, we need to make sure this patient is allowed to leave AMA. Maybe that sounds weird, but let me explain. If you are choosing to leave the hospital before it is your time to be discharged, you have to be of sound mind to make medical decisions, meaning that your dementia patient that is only oriented to themselves, who is saying they want to go home, they're not able to make those medical decisions, and it would not be safe to let that patient leave. Your suicidal or homicidal patients are also not allowed to leave until they are cleared by psych to leave the hospital. Second thing that needs to happen is a provider needs to speak with the patient about the risks of them leaving the hospital before being medically cleared to do so. Now, sometimes patients are adamant about leaving. They're of sound mind. They're able to make that decision to leave, and they choose to do so before the provider can get there. That happens sometimes, and what we usually do is on the AMA form that a patient would sign, we would write patient left before provider able to speak to patient. Some nurses can get really butthurt when their patient leaves AMA. I don't necessarily understand this. If your patient is able to make that decision, even if you disagree with it, they're able to make that decision. Whenever I have a patient that wants to leave the hospital before they're ready, I try to understand, like, okay, what are their reasons for leaving? Is it because they have a pet at home that they're concerned about feeding and I can help call somebody to go feed their pet? Is it because they're unhappy with the care they've been receiving? Is there something I can do on my end to help make their hospital stay a little bit better? Always try to seek to understand the patient instead of just judging them for why they're leaving. Is there something that we can do on the hospital's end to make this better and help that patient stay? Sometimes it doesn't really matter if you do everything possible. They're just going to leave anyways, and that's fine. That is their decision. Couple other things about AMA, and this may be depending on your hospital or state that you work in. If a patient is wanting to leave the hospital, they need to be able to physically do so on their own, meaning the hospital is not going to arrange for them to go someplace or arrange for transport. They need to be able to arrange for their own transportation to wherever they're going to be leaving to. If they're needing prescriptions for medications, providers are not going to be writing those prescriptions because it's not time to discharge yet. And so they're going to have to seek out those prescriptions from their primary care or get them somewhere else. So that's a little bit more information about AMA. Let me know if you have any questions. I'm happy to talk a little bit more about this.